Hello, and my name is Robert Pulver, and I'm standing here before you today to discuss the topic of rising healthcare costs in the U.S., more specifically in the rising cost of the EpiPen by Mylan. According to O'Reilly, EpiPen is a life-saving device that is derived of a precise emergency dose of epinephrine given to patients having an allergic reaction. Healthcare costs continue to rise based upon a number of factors which affect patients' abilities to seek treatment or continue treatment. This health issue affects everyone with allergies, but on a broader scale, our entire population of people that seek out healthcare services. The impact of EpiPen on the community is patients not being able to afford this life-saving medication that they need. This health issue needs to be addressed because it is showing the monopolizing ways of major pharmaceutical companies, and we need to do our part to provide affordable medication options to the community. My proposed policy today is to have regulation on the cost of EpiPen, which will provide affordable EpiPen costs to our community. This policy will address one of the issues with rising costs in healthcare. Pharmaceutical companies continue to monopolize the market, whether brand name or generic. According to Kahn and Van Hissen, brand name companies continue to work with generic companies to keep their grasp on the market by paying generic companies off or with a portion of their profits to delay or stop them going to market. This agreement with these companies is not broaching on anything illegal, but gives the power to these companies that then can turn around and can control and or raise costs, knowing that they have the generic companies controlled and there is not another alternative for these patients. When it comes to EpiPen, they are doing exactly that and raising the cost, knowing that the marketing has been pushed out and the changes they have made, turning EpiPen into dual packs for consumers in order to raise prices and raising those prices to costs over 400% above recent costs. According to Carrier and Maniti, EpiPen costs pennies to produce, yet costs have been raised on a dual pack to over $600. EpiPen has done an excellent job of making the consumer feel like they need this product, and in reality, they do. If a patient has an allergic reaction and needs life-saving measures, EpiPen can be a useful and life-saving resource delivering a medication that they need at a safe and exact dose. Unfortunately, not all patients may be able to afford that cost, and how can we put a price tag on someone's life? According to Tansey, patients will find other methods of delivering the medication they need by using ampules or creating their own devices that take time and cannot be as safe because they're not delivering that exact dosage that is delivered through EpiPen. We're also trusting that parents and non-healthcare professionals will be able to deliver this life-saving medication in a safe and effective manner. All the while, there is a device on the market that already makes us safe and delivers an exact dose, yet many cannot afford now. That is why I stand here before you today, asking you to consider my proposed policy of having stricter regulations and monitoring of drug prices, and with Mylan doing with EpiPen. This policy will affect many in the community by delivering more affordable medication for life-saving measures, and by setting the tone with this policy, we can move forward to other pharmaceutical companies in order to address the continuous rise in healthcare costs and medication. The School Access to Emergency Epinephrine Act of 2013, passed by Congress, has had huge effects on the community in a positive way, but there are still negative consequences of such a bill. This bill incentivizes schools to carry EpiPens, and EpiPen has done a great job of supporting this bill and has contributed over $4 million to support this bill. According to Carrier and Maniti, with this bill in place, EpiPen continues to donate free EpiPens to over 65,000 U.S. schools, which covers over half of the schools in the U.S. While these numbers sway in the positive direction for EpiPen, the money they have invested is for a reason, and that is to continue to corner almost 95% of the market share. The costs of this policy are unknown at this time because we are unsure of the backlash we'll receive on the school end if EpiPen decides to pull out of the Emergency Access Act and stops giving out these free EpiPens to schools. What we're really here to discuss is the other half that don't get free EpiPens. The risk of not moving forward with this policy is showing that we in Congress can be bought and pharmaceutical costs continue to rise. Whether conservative, Republican, Democrat, we are all affected. At this rate, there is nothing to stop EpiPen from continuing to raise their costs, forcing consumers into not being able to afford this life-saving device. Lives can be changed and saved with this policy being put into place. the government can have more of a hand in controlling and regulating the costs of drugs and EpiPen specifically. We understand that those that had a hand in the bill passed in 2013 will not look upon this regulation in a positive fashion, but it is more important than just our children. If we regulate the cost of EpiPen and bring more affordable costs to the consumer, patients can afford to purchase this product that can save their children. Put yourself in their shoes of going to a pharmacy to purchase a drug that was upwards of $600 that would need to be replaced on a yearly basis, whether it was used or not. This doesn't blur the lines of political parties, but could you put a price tag on your child's life? It is our duty in the government to protect the public against corporate greed and make this contribution to the healthcare community and start to provide cost regulation in order to drive down costs, and this will provide a healthier and safer community. Our community is asking for help and drowning in healthcare costs. This one change in policy can be the change that we need to head in the right direction and help patients get the medication they need at an affordable price. This becomes very important in the case of EpiPen, with a medication that can be the difference between life and death. I appreciate your time today, and I urge you to consider passing this through legislation in order to look out for our community and our patients in need.